Welcome to Where Parents Talk. My name is Lianne Castelino. Our guest today is a licensed social worker, a clinical therapist, and an eating disorder specialist. Kyla Fox is also founder of the Kyla Fox Centre, an eating disorder clinic in Toronto. She's also a mother of two, and she joins us today from Toronto. Thank you so much for being here.
Thank you so much for having me, Lianne.
Really important topic because we saw all kinds of statistics about eating disorders on the increase as it relates to hospitalizations and certainly young people over the pandemic. And I wonder, Kyla, could you take us through some of the current trends that you are seeing as it relates to eating disorders and young people?
Well, the truth is that even though the numbers were skyrocketing during the pandemic, they haven't slowed down. And that's the very sad truth about eating disorders. And despite the fact that life has found itself back to normal in many ways, what we do see is obviously the impact on mental health for young people has been tremendous. And so even though life has returned to be close to what it used to be, if not exactly what it used to be, young people are still deeply impacted by COVID and all of the repercussions of what that meant for their lives. And so eating disorders still find a very, very, very real place in so many young people and in so many families.
So, as an eating disorder specialist, what concerns you most about what you're seeing?
Well, I've always been deeply concerned about people impacted by eating disorders. I think that my concern isn't any more now than it ever was. I think the reality is that there's more that we obviously are speaking about when it comes to this issue. But really, I think part of what we have to recognize about eating disorders is that they show up in food in the body when it comes to their presentation, but they're really actually about so many other complex issues that show up in young people's lives. And so, though we may try to look at a person's relationship with food in their body and dictate their capacity for wellness or the trajectory of their recovery, what we have to be very, very mindful of are the psychological and emotional, relational, familial, biological impacts that have happened to the people who are impacted and really work at addressing those spaces. The other thing that I think is important too is that when we're working with young people, at least at the center for sure, we're always working with families and we're working very, very closely with parents because we know that parents are leading the way for their children's lives. And so part of a huge piece of our care is helping to teach parents and support parents and how to really, really create open communication and connection and learn about eating disorders in really new and different ways so that they can support their children quite differently.
Let's break down a little bit there of what you just addressed, starting with could you provide some examples of some of those extraneous issues that you referred to that would affect an adolescent, a young person that could potentially then point them to having an eating disorder?
It's really anything that could happen in someone's life. I think we can never underestimate the constitution of a person in terms of their ability to move through things or how they do. I also think that the impact of obviously COVID, familial situations, peer experiences, social media, pressures of life and school, the way that kids feel about themselves, like our sense of worth is really very much at the core, in addition to genetics and those kinds of pieces. So sometimes people will say to me, Kyla, I'm looking like, what is the thing? What is the thing that sent my child in this direction? And the truth is that there often isn't a thing. There often isn't one golden nugget that like pivoted someone down the road of an eating disorder. What I really talk about is the ways that all of our life experiences shape us. And depending upon who we manage those experiences in different ways. We move through them or not in different ways. And so all of those things make up what might lead a person to want to control food and their body.
Along those lines, then, how often is a parent's relationship with food something that they inadvertently or maybe intentionally project on their child, and therefore that then becomes a main cause of that child's relationship with food?
It's such a great question. And, I answer this with not to blame parents because I think that we all are moving through so many things in our own lives. But I do think it is a very important factor because as parents, we shape the environment for our children. And we also model and give information about food and bodies, even if it's about our own body. And the incredible thing about our children is that they love us and they're sponges to our experience. And so, what we do, what we say, how we understand the world, the judgments that we make on ourselves or others, our ideas about food, healthy, unhealthy, good, bad, all the things that we speak about that we might not also not even be conscious of, that is informing our children all the time about who they are, how they should feel about themselves, how we feel about ourselves. So I do think it is a very important piece, especially in the work of recovery, that parents participate in that work too.
When we talk about our relationship with food and in our families, it certainly starts at a very young age, from the time you could probably argue when a baby is first exposed to food. So let's talk along those lines then about picky eaters. What do parents need to know about whether a child is truly a picky eater and has a dislike for a certain food versus something else?
So one of the eating disorders that has a lot of prevalence is an eating disorder called ARFID. It's avoidant restrictive food intake disorder, and it definitely shows itself in the form of picky eating. So, like you said, there are a lot of children who present as picky eaters, and it may be quite innocent. Sometimes it's really just an assertion of some element of control. Sometimes it's legitimate like and dislike. And it's hard to always know the difference, except to say that if picky eating becomes a way that a child is therefore then more isolated and unable to integrate into certain situations, is incredibly narrow in their food choices and therefore is nutritionally deficient, or isn't growing up to capacity on their growth chart, when it's starting to affect kids, obviously, mentally, emotionally, psychologically, physically, those things are obviously very much more in the direction of an eating disorder. And so ARFID is an eating disorder that presents itself in younger kids, usually 12 years and younger. And so it's about monitoring when a young child is, a picky eater and then can maybe transition and move through environments and spaces with food with more ease, or if they remain quite steadfast in their decision making and don't have a lot of openness or room for breaking out of their particularities and such.
In that case, then, when should a parent consider getting help, and where should they go as a next step?
I always think, well, I say this as a parent too. So I feel like there's two pieces that happen, even for me as a parent. It's like, do I make this a big deal? Is it a big deal? Or like, should I leave it? Maybe they'll grow out of it. And so I feel like we're always navigating that as parents. Like, when is something important enough to address? And when is it not? When do you just leave it? And, I think about that with my own daughters as well. I think that, you know, if it's concerning for you, if you're feeling like it's occupying your mind, time, and energy, if it's changing the way that you're, connecting to your child or how you're addressing things with them, I would say for sure you should ask for some support. And at least I feel that information is invalid and it allows parents to at least have made connections, to at least feel like they're heard and listened to, and ultimately to have some direction should things continue to become differently problematic or more serious, or they may go away.
Is there an ideal window of time then, if you are concerned but not sure, and contemplating getting external help, that you should really be moving within a certain period of time. Does that exist with an eating disorder?
Well, I always feel like a lot of things that people will say is, I didn't know, or we didn't think it was as serious as it was, or, my child was engaging in what we deemed as healthy behavior, and so it didn't seem problematic. And so I don't want to suggest that there's like a short window, and if you miss it, that's it, you're done. I don't think that's the case. I think what is important is that you do enter into that window, or you do ask for support wherever that may be, so that your child knows that you're aware, you're thinking about this in a different way, you're taking this seriously, and at least you're asking for other, insights and answers that I think are really, really important.
What about the parent who maybe has made the decision that they need to get extra support from a professional, but now is faced with a child, an adolescent, teen, tween, who does not want to participate in getting help? What can you suggest to that parent?
We see this all the time, that parents are worried and ready and will do anything, and their child is resistant. So I suppose age and stage of life determines whether or not a child would have to participate in care. But what I always say is that there is so much work that we do with parents, specifically when their children are not open, willing, ready to engage, because when some part of the system starts to make change, it actually does shift the system entirely. And so if parents are engaging in treatment and in recovery and are getting the support that they need, that will start to change the way that they interact with that child, the things they say, the way they go about things. And that will inadvertently start to shift the patterns in the home, and hopefully get that child to a place where they would be more open to joining into the process. I think what we can do as parents is model what we hope for. And if our child sees that we're engaging in care and it's okay and it's safe and it's normal, then they may be more likely to sign up too. So I think it's just really important to do that. I also feel like the other pieces, of course, are if your child is medically unstable, or if there's, things in that realm, then serious action in terms of making sure they're safe needs to be taken place. And, professionals can guide you on those pieces too.
With respect to your clientele, the families you see, the young people you deal with, are there certain sort of patterns in terms of obstacles and pitfalls that you see families falling into, that it then becomes a real critical, catastrophe by the time they come to see you?
Well, I think, and I say this also as a parent, I mean, we love our children so much. There's nothing we want to do except to see them thrive and be well and happy. And I think inadvertently, what may happen a lot, especially with children and parents, is probably a bit too much time negotiating, and a bit too much time allowing the child to have so much insight and input into how, their care needs to go. Sometimes I think, when someone's really impacted by an eating disorder, they don't necessarily feel ready to get help. They don't necessarily know that they need it. They don't necessarily think there's a problem. And so I think a lot of families spend a lot of time like trying to convince or negotiate. And I would argue that perhaps those kinds of patterns are things that we work on a lot, and just to help end those cycles and just teach parents how to have different boundaries and different language, so that those patterns can start to go away.
It certainly would appear that we've come a long way as a society in terms of the discourse around eating disorders. Just in talking about in general terms, knowing terms like anorexia and bulimia and some of the others. What's your assessment as somebody who's basically their entire life has been dedicated to this subject, and the lived experience that you've brought to it? What is your assessment of where we are in society today on this topic, and where do we need to go?
I think that eating disorders are more spoken about, but I do feel like there's space in the language and understanding of eating disorders that requires a lot more knowledge and information. And I think that when we think about eating disorders, like you said, it's really often that people will think about things like anorexia or bulimia. The way that we talk about eating disorders at the center is really more about the behaviors in terms of binging, purging, and restricting. And that's because most people who are impacted by eating disorders don't fit nicely into those boxes of anorexia, bulimia, or binge eating, or orthorexia, or whatever that may be. Often people, across the journey of their suffering, vacillate through different ways of being with food, all of which encompass at one point or another, perhaps binge, purge, and restrict. So part of what I think opens up for people, if we can, consider those labels differently and just really look at the behaviors, is that not every single person who suffers with severe restrictive tendencies is anorexic or may even appear as such, but it doesn't mean that they're not severely restricting. Similarly, not every single person who's engaging in cycles of binging and purging will consume as much as what we would typically understand as a binge or purge through vomiting. So I think we have to sort of open up the sort of the spectrum of how we think about eating disorder behavior, and also not look at people's bodies as a measure of their wellness or lack thereof, but really start to see eating disorders beyond what a person looks like, beyond what they do or don't do with food, and really recognize that this is a most severe mental health issue that impacts people in moment by moment for a very, very long period of time.
Now, Kyla, we alluded to your lived experience as a teenager, having suffered with anorexia. When you look back on it, were you able to pinpoint the root cause of why you went down that journey? And also take us through what you wish you would have had access to in terms of help and support and treatment that you now provide at your center.
I feel like one of the things, there isn't one particular root cause, but what I have come to really learn is that so much of what I've been through in my life shaped me and taught me about who I am, who I'm not, my sense of worth. And I think that there was a lot in my life that was often not talked about. There was a lot in my life that I felt I had to live up to. There was a lot of performance, and I think a lot of pretending. And I think often in response to so much that I didn't understand when I was young, and so much that was just really unsaid and not really dealt with. And so those elements of restriction, if you will, like the silence and the secrecy and the withholding and the pretending, that really started to transform itself into my need to restrict something I could control, which was the food. One of the things we talk about at the center is really helping people to understand the eating disorder symptoms far beyond food in the body, and really to see how they show up in people's lives, which is really at the core of what they have to address. So when I think about some of the ways that I would have really required a lot of support, I think first of all is like I needed treatment right away. I needed people who understood eating disorders very, very well, and I needed to have access to that care immediately. That wasn't available for me. So I think that is something obviously that I've tried to close the gap on in terms of having the center, is really knowing that people don't have to wait for care. We can provide services for people right away. I also think that it would have been very, very important for my parents to join me in the process, and for the long term, because I think our family needed to do a lot of work to process the things that we had been through that really impacted not only my life, but the lives of my siblings and my parents. And so I think that what I really do find at the center is that, people can move through recovery in really different strides when those around them are really actively involved in the work of change. And that not only the person who's like the identified person with the eating disorder, that they're not the only ones doing the work, but that everyone around them is too, which actually really helps them to feel like they can as well.
It must be pretty transformative when you see that playing out with your patients and their families in many ways. And I wonder, when you look at becoming a parent and being a parent, everything changes in terms of how we see the world. How has your lived experience with an eating disorder impacted the way that you parent your young daughters?
Oh my gosh, Liam, like I could go on forever because I think like at a starting point, I come into being a parent at a very at a what am I trying to say? At a place of feeling so deeply privileged that my body allowed me to do that, which I never imagined it could after all I had put it through. Um, I also think that it matters very, very much to me that in our family that we talk always about feelings and experiences, and that we are not a perfect family, and I am certainly not a perfect parent. Nobody ever could be. And I think the way in which repair happens is a very critical part of how I try to parent, which means that should things happen, or when feelings get hurt, or when conflict occurs, or when something happens in someone's life, that it isn't about like, pretending it didn't happen or brushing it under the rug. That there is a level of responsibility that I step into as a parent when I do something, or I just feel a tremendous amount of responsibility to model what it means to be imperfect, and to model how to create correction, and to model that there isn't such a thing as perfection. We do a lot of talking in that way. I think when it comes to food and the body specifically, obviously over the many years I've worked in so many different ways to have a space of peace when it comes to food in my body, and I do really feel like I've reached a place of that. And so in that way I feel like I can model that differently for my children. But I also think, like, we talk a lot about the body, and we talk a lot about food. We come together around food very consistently as a family. I really try, to normalize eating. I eat the things my kids eat. They eat the things I eat. Food is like a really safe and beautiful experience for our family. And I think it's really just, talking. We do so much talking. I know that sounds maybe a bit crazy, but we do so much talking because sometimes I think as parents, we think our kids don't know, or they're too young, or they're resilient, they'll get over it. But I actually feel like kids are so wise and they absorb so much. And I think if we can give more space to let them express themselves, it's very powerful to hear what they understand and to be with them through their feelings and through their life experiences.
Kyla, let me ask you now, you are the parent of two young daughters, and girls typically tend to be more affected by eating disorders, not exclusively to boys, but more so. And certainly, if we look at hospitalizations as a result of eating disorders during the pandemic, the numbers are quite striking for girls. You've got in the last several years the added dimension of social media and other things going on that you might not be aware of as a parent, and many other parents aren't aware of in their own homes. How do you go about, and is there anything else that you do when you're talking to parents of girls who may show signs of an eating disorder?
Oh, I mean, as a parent, I feel equally worried and frightened about those things. Like, just because I have this expertise and do this work every day, it doesn't mean I'm exempt from the fears or the worries around what it means that my daughters will be exposed to all the things that every young person is as well. Um, I think what, again, it might go back to some of those pieces. Like, it really matters to me to know, and obviously my kids are younger and they still want me to be a part of their lives in different ways. They're not shutting the door. Maybe they will when they're teenagers. I don't know. Hopefully not. But I think part of it is just like creating openness so that they come to me. Like, I want my children to come to me. I want them to know that that is safe for them. I want them to know that there's an open road, that I will be able to receive what they're moving through. And not that I'm going to always just be so light about it, but I'm going to help them and I'm going to guide them. And I feel like that's what we try to do as parents in our home, is just really create this deep understanding that like we are there, and not just that we say it, like we're modeling that all the time. Our kids go through stuff all the time, age appropriate things all the time that impact them, that change them, that hurt them, that make them do all kinds of things to them. And I think part of what I'm trying to do all the time is like set the foundation for when the really differently hard things happen, that they can come to us. And so it's like keeping an open mind. And I do a lot of like, sometimes I just might take a few breaths before I say something, so that I can just be really grounded. I give a lot of space for them to share. I don't do a lot of like, oh, you're okay, or don't worry about that. Like I actually do more of like, tell me more about it. Teach me, like, what does that feel like for you? I do a lot more of those kinds of things because I really want to invite them to know that whatever it is that they're going through, that they can share that with me.
Let's talk about the Kyla Fox Centre and specifically the fact that you offer a multi-pronged approach to supporting patients with eating disorders. What does that look like?
Well, the center is a comprehensive eating disorder recovery center. And obviously, now that we're fully virtual, we work with people on an outpatient basis. Our intention is to be able to translate recovery into life and bring life into recovery. And that's been one of the beautiful benefits of turning fully virtual, is that people don't have to leave school or work and for a day and come stay with us in the center. They have the ability to maintain their connections and commitments in life while also integrating recovery into that. So it's allowed for recovery to be so differently effective. We watch people get well so much more quickly and be able to have longevity in their recovery in ways that we have never seen before. So it's been pretty incredible in that way. I think one of the things that I think about, and I've always thought about, is that treating eating disorders isn't about treating food. It's not a food problem, and it isn't about restoring someone's physical body. Those are two very, very critical parts of recovery, but eating disorder recovery doesn't start and stop there. And so one of the things that really matters to me and always has is being able to look at a person from a very holistic perspective. And like you had said earlier, everything we do is really intertwined. It's very, very hard to pull apart a life experience from, let's say, how someone feels in their body, or what decisions they make around food, or how that leads to the partner that they might choose. Like, in my opinion, and in my sort of way that I think about things, is it's all very interconnected. So at the center, we really support people from a very, very holistic perspective. And it's not only people who are acutely impacted by eating disorders. We support people who are just impacted by food in different ways. It may be someone who's been yo-yo dieting for their whole life. It could be a parent who's worried about their picky eating kid. It could be someone who's had acute anorexia. It could be someone who is going through menopause. It could be someone who's pregnant. It could be a father that's so worried about, their child in sport. It could be anything under the gamut in terms of how people might think and feel about food in their body. And you don't have to, have a diagnosis of an eating disorder so much as just really wanting to repair or be in a better, safer relationship with food in your body. And so we look at people nutritionally, we look at people therapeutically, individual therapy, family therapy, couple therapy, parent-only support, group support. When we support people nutritionally, we provide them, if they need with meal support, or helping them, plan meals for their children, or food shop, or break rules and rituals when it comes to the things they can and cannot eat. And then there's a whole realm about the body, when you have an eating disorder, or just, when you don't feel good about yourself, you really do disconnect from your body. And so there's a need to really repair the relationship between mind and body and help people to really understand the messaging of their body. So we do a lot of somatic therapy, yoga, movement, arts therapy, all different kinds of ways that we support people beyond just talk therapy. Could be movement, mindfulness, meditation, Reiki, different sort of elements in that regard. We always work with our clients' medical teams, especially if that's a critical part of their care. Collaboration is very, very important to us. And we really want to help people feel really like, what's the word? I don't like really padded around them, like that there's a lot of safety and they're being held, and that the messaging around them is consistent, and that the care is consistent. So often people talk to us about, this person said this and that person said that, and I just feel so confused. I don't know what to do. So that's a whole part of the purpose of our holistic care team, is that we're all working with the same intention. We have the same language. We work so closely together with each other, with our clients, and their medical teams, with the intention to really move them to a new place of health in their life.
Certainly lots of important information for all of us to consider, whether we have an eating disorder or not, with respect to our relationship with food. Kyla Fox, clinical therapist, eating disorder specialist, and founder of the Kyla Fox Centre. Thank you so much for taking the time to share your perspective today.
Thank you so much for having me. I really appreciate it.